Welcome to today's webinar presented by Supercoder.com. Supercoder.com is an online coding solution offering Part A and B coding reference tools, resources, and not more than 30 specialty coding and compliance newsletters from the Coding Institute in one site. I hope you enjoy this short session.
Or about anything else, just feel free to email me at any time, no problem. Okay, we do have a full schedule here with this information today because it's rather tedious, so let's get right on it, and we want to start with slide number 3. Last year, 2011, the AMA went through and changed a lot of the codes for the vascular aspect of ultrasound, and then ultimately into the interventional area as well. And one of the ones that they did clean up was even in the non-vascular ultrasound arena, and that was the 2011 we were using 76880, and of course that was deleted in 2011, and they gave us 2 codes to take care of this non-vascular aspect of extremity ultrasound. The 76881 is the complete code, and the 76882 is the limited code. They also gave us some pretty specific parameters as to what's going to constitute a complete ultrasound of the extremity. And on slide 4, you'll see that there's basically 5 areas of content that you should be looking for as coders in order to be able to assign a complete extremity ultrasound. This is basically of the joint we're looking at, and the aspects of that documentation should include something about the muscles, the tendons, the joint itself, any soft tissue structures surrounding the joint, and any identifiable abnormality. And just like with the ultrasound of the abdomen and the retroperitoneal, if all 5 of those components aren't documented, then it's got to be a limited study. So this is the kind of information that you need to take to your docs and let them know that, you know, these 5 areas have to be documented when they're going to be doing an ultrasound of a joint, or if they do 4 of them and that's still not 5, then you're going to have to downcode that to a limited. And it seems, you know, really counterproductive for them to have done all the work and forget one, and then you've got to downcode it to a limited study. So make sure they understand what it is that constitutes this complete ultrasound for 76881. On slide 5, 76882 is the limited study, and that's primarily if you're going to evaluate 1 or 2 of those aspects that were included in the complete study. It's a limited examination where they're basically looking at the specific atomic structure, such as a tendon or a muscle. In addition, it would be also coded to evaluate a soft tissue mass. Prior to this, it was anybody's guess as to what we were using for that. So thank God they did come up with this, and this is the one that we would use now to code for ultrasound of soft tissue mass. On slide 6, they also rearranged a lot of the NIPS codes, as we call them, the non-invasive physiologic study, or the vascular lab codes. If you're a surgeon's office, you use them as vascular lab codes. Basically, CPT 93922 was looked at by Medicare primarily because they noticed that there was an awful lot of increase in the amount of that particular code that was being billed. It's obviously their concern was that the ankle brachial index, or the ABI, was being used inappropriately. What they were finding is that just the determination of the IBI itself was being performed, and these codes were being assigned, and that wasn't the intention of these codes to begin with. If you were just doing an ABI measurement, that should have been added into your E&M code and not a special CPT code for a diagnostic study. So they went to the AMA and CMS went to the specialist societies, primarily the ACR, American.
SuperCoder is the fastest-growing online reference tool with more than 25,000 subscribers. Call 866-228-9252 to get a free product demo or sign up at supercoder.com for a 7-day free trial.